Omicron.
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 Well, welcome, folks. It's Wednesday and time for the Progress Report. Thank you for tuning in. I hope you enjoyed our little one-off opening sequence there. A little hint as to what we're going to be talking about here on the show, kind of a sledgehammer-style hint. But we have a great guest. I first want to explain that you're seeing me here first because Bob is not here. He's in the COVID protocol. The guy caught it. He's... he's not in bad company. A lot of people are catching this Omicron virus, Omicron as it may be. But we felt that the show was so important that we would go with the second string, and I'm going to step up and try to put on a good show for you folks. We have a great guest. He's been on the show before. It's Phil Alexikos. I always worry about getting that name right, and it'll be Phil from now on, from the Manchester Public Health Department. And again, we felt this was an important, informative show that we needed to put out. And Phil is busier than what do you want to call it, a one-arm paper hanger. He and his people and his department are working day and night to fight this COVID crisis and doing a darn good job despite a real monumental task. So when we saw he was available, we took the opportunity. I want to make a point of saying that this would be a great time for you, our viewers, if you have questions about COVID, about the COVID protocols, about the new rules. That's what we're going to try to hit on. But please call in, and you can ask directly to Phil. He's more than willing to provide the best answers he's got for your questions. I know I have questions. I deal with this COVID thing every day in my job. So looking forward to speaking with Phil. To call in, the number is 603-640-3091. We have to put 603 now because one town has a weird exchange. I don't know why that is, but it is what it is. 603-640-3091. And you will notice that both I and our guest are wearing our masks. We are trying to set a good example. It's not the easiest things to do, and we'll talk about it. But enough from me. Let's get to the expert. Phil, welcome to the show. We're very happy to have you. Before we talk about Omicron or any of the other public health issues here in the city, and we may get something more than COVID, but sure. Please tell us a little bit about yourself. Sure. How you end up in Manchester, how you end up at the health department, what you've been doing there for the past few years.
Well, thank you. Yeah, it's been more than a few years. Definitely have made a career out of practicing public health at the local level. My degree is in biology and grew up in Bedford, went to Manchester West High School. So I'm a West High grad. I really love, this part of the country. You're an hour from anything, the mountains, the lakes, the ocean, Boston. So you can really, it's a great place to live all the way around. And, I come from a family of public service and public servants. And, when I saw that a job was opened at the health department, I thought, well, this might be a good way to use my knowledge and, my desire to help folks. And, went back to school, earned a degree in public health, teach public health at UNH, environmental health in particular. So I'm really service-driven, education-driven, really love the community. I've been with the department now for 27 years, and I oversee the health protection section of the health department, which includes environmental health, infectious disease prevention and control, and public health emergency preparedness. And, as much as we had plans to address a whole host of different crises, we've really put them into overdrive in terms of combating and tackling COVID. So, I definitely love the community and really am committed to service like my colleagues are at the health department.
Well, I want to lead off with that because I don't want the show to end without having a few minutes at least, if not more, to talk about the really excellent work that the Manchester Public Health Department performs for the citizens of Manchester every day. What they were doing before COVID, what they'll do after COVID, that's one thing. But in this crisis that has just gone on and been such a long grind, can you talk a little bit about the staff and what they've had to go through? They have their own families to deal with.
Right.
They're dealing with COVID just like all of the rest of us. Tell us a little bit. Let's celebrate them a little bit.
Well, thanks for the opportunity to talk about that because, while we're working, we're often the worst at promoting, what we do on a daily basis. And, the real tenets are education, and also, protection. And I look at those two things as really practicing public health. Since the beginning of the pandemic, we have been investigating cases of COVID in all settings. So whether it's a household, a business, schools, you name it, we were involved at every level and tens of thousands of cases early on. We were doing the individual contact tracing, we were doing outbreaks and cluster investigations, et cetera. We've been intimately involved in testing early on, where we ran a testing site in conjunction with Manchester Fire at the Manchester Armory for several months early on in the pandemic. And then we transitioned once the vaccine became available with a focus really on our most vulnerable citizens. So we spent countless days, not only from a first and second dose perspective, but also a round of booster doses as well, going out to every Manchester Housing and Redevelopment Authority high-rise or congregate living setting. So we vaccinated, probably have done at least 2,000 doses in that venue. We have vaccinated school personnel, not only in Manchester, but also in our neighboring towns, which we have great partnerships with. We've been out to do school children now that the Pfizer vaccine is authorized for ages 5 and older. We've done anything from first, second doses, now booster doses, and most recently, the boosters were authorized for ages 12 and up. So we've already initiated several rounds of those clinics. We're having a family vax night, this Friday, and within a couple of hours of releasing, that portal for registration, we had over 100 families sign up, which is amazing. And so we continue to try to meet people where they're at, and we also have been working with a lot of social service and other partners in the community, bringing the vaccine to where people are at, because we know that people have the ability to make appointments, whether it's a primary care office or a pharmacy, but we really need to look at folks that can't get there or have different barriers, and that's our focus. And I want to tout something. Since November 5th, we've been out in the community and have done over 55 clinics, not only on our campus at the health department, but off-site. We've done over 5,000 doses and over 3,500 boosters. So we've participated in both booster blitzes. We did 700 doses at the first booster blitz. We did over 900 doses in the most recent one. And we continue to offer any vaccine, any COVID vaccine at the health department, Monday mornings from 9 to 11 and Wednesday afternoons from 2 to 4. And that's in addition to all of the other clinics that we've been doing off-site. And
talk about
it's a lot.
Retail healthcare is what you're providing here.
We are trying to fill the void, and as many people know, for a long time in December, you couldn't get a booster appointment, and we were out there on the daily, getting out to the folks that were most at risk, and then making it available to the public, and we continue to do so. We have clinics booked this week into next week. And then we'll continue to run our clinics through the month of January at least, as things unfold.
Well, it looks like we have a caller on the line. Go ahead. Welcome to the Progress Report. Hello?
Hello?
Your TV is awfully loud.
Hi, Mike.
Oh, Bob, how you doing?
Hi, Bob.
You should be in bed, Bob. What are you doing up?
How are you?
I'm doing fine, guys, and I'm
Good.
so glad, Mike, that you're carrying on with this show.
Turn your TV down, Bob.
No, I'm not. No, I'm feeling fine.
That's better.
I'm just pleased that you guys are doing this show. You're doing a great job. But I did have a couple of questions that I thought might be of general interest. They're certainly of interest to me. One is that having tested positive for COVID, which was kind of a surprise, and now being in quarantine, I'm now really interested in doing follow-up tests. What's the best place to go to get the tests? And is there a real difference between the the antigen test that you can do at home and the PCR test that you may not be able to do at home? And that's my first question. And the second one, this is very personal. Now that I'm in quarantine for at least 5 days, how long should it be if I get my test kits before I could expect to test negative and be able to be out and about like I'd like to be?
Yes.
I think you're doing a great job, guys, both of you.
Well,
And thank you. And I'll listen to Phil's answer off the air. And
Excellent.
Phil, thanks for coming on.
Oh, you're welcome,
Bye.
Bob.
excellent, Bob. I'm glad for those training wheels. They always help, Bob. I appreciate it. And actually, let's talk about the testing because I have some questions about that
Yep.
too. In particular, Bob's second question. But
Yeah.
I'm going to defer that. Let's go to his first question.
Yep.
What's the best place? How to get tested? Quickest way to do it? And maybe give us some options.
Yep.
And then the question between the antigen and the PCR test. What's the difference, and what are they looking at? And then we can get to the second part because I think that's related to the first part.
Yeah, there's a lot to unpack when it comes to testing, but there are some really key points that in Bob's circumstance and anybody else who has already tested positive, whether it's a positive rapid antigen test, a home kit, or if you are getting tested at a location, or a PCR test, if you're positive and you get treated as such, and then you enter the isolation phase. And I like to say ill, isolate, exposed, quarantine. I mean, we get a lot of jargon in public health, so understanding that is important. But in terms of ending your isolation, what is really important is that CDC and the state of New Hampshire has very recently, updated its guidelines or guidance around what to do if you are COVID positive. How many days do you have to wait before you kind of re-enter civilization, if you will? It used to be 10 days, and now it is 5 days. However, there are some strong suggestions that someone seek out a test on day 5 before you were to return to work or school on day 6, in addition to continuing to use face coverings for the duration of what used to be the 10-day isolation. These decisions are not made in a vacuum. There are considerations that are made for things like testing availability and a whole host of different things. But what was really telling to me is that in the research that was done, at day 5, which is the day that testing is suggested, there's still over 30 or around 30% of people could still be positive on a rapid antigen test. And a rapid antigen test is generally a good indication that you are infectious. So if you are positive and you also are positive via a rapid antigen test, it's saying that you are likely able to continue to spread the virus to others. That's why that is a strong suggestion. I think in an ideal world, that would be a requirement, but unfortunately, the world we live in, there is a shortage of testing in general. So it's sort of like
Not to mention a shortage of everybody.
Well, yeah, and notwithstanding staffing.
Yeah.
So if you are positive and you are at day 5, that is a good day that you would want to take a rapid antigen test. And if that test is negative, that's a strong indicator that you are not infectious anymore. We have initiated that in the city for city staff. We perform those tests because our critical infrastructure and workforce, if everybody's sick at the same time, service delivery would be impacted. So we are able to provide that service. And in our very limited sample, we are seeing that there's a fair amount of people that are still positive on day 5. And that means that then they have to wait the duration of the regular 10-day isolation because they are still
That
thought
was
to be
my
infectious.
question. So what
Yeah.
what do you do if your second
Yeah.
test comes back positive? I know people who that's happened
Correct.
to, and I did not know what to tell them. So you're saying, okay,
Yeah.
you just keep another 5 days of isolation.
Yeah.
Now, what about 24 hours symptom free?
That
How does
is-
that tie into to these rules?
Yeah, that's in addition to. So in order to use the benefit, I guess, as a way of putting it, of the reduced time, you have to be symptom-free for, symptom-free and fever-free for 24 hours. So if you're still symptomatic and have a fever on day 6, you don't even need to take a test. You're still under that isolation. That 10 days is the window of time that you are not going to be infectious after 10 days. What they're trying to do is say, is there a way that we can reduce that safely, because we know people need to go to work, go to school, etc., but we still have to make sure we don't put people at risk, because there are people that are still going to be infectious, and that's why face coverings help, and that's two-way face covering. So it's not just the person who's wearing a face covering is stopping things at the source, and you may read that, well, these viruses are 0.1 microns and it's not going to get trapped by a face covering. Well, the higher grade the face covering is, and we can talk a little bit about this right after the question. Yeah. Viruses don't float around by themselves. They are attached to droplets, other particles, and so that is what is getting stuck in a face covering.
Excellent point.
So even though, yes, if you look, it says, well, this is smaller than what a face covering or a respirator or whatever device you have, it's not as simple as it's not absolute. And so it helps. And if I'm wearing one and you're wearing one and everyone else is, that's tampering down the risk, because only around 50% of our citizens are fully vaccinated, and that definition has changed, which we'll talk about.
And I do want to talk about vaccination.
Yeah.
I actually was going to lead with vaccinations, but Bob kind of
Sure,
kicked us
yeah.
off on
We'll cover
the
it all.
quarantine, which is good. I just want to bring it home. You've tested positive. You've isolated for the 5 days. You've tested positive again. Now you're in your second 5 days. You're symptom-free. After 10 days,
Yes.
can you safely go out without infecting someone else if you feel good, if you're symptom-free?
Yeah, if you look at all of the data, and there are data that suggest it's a curve of how infectious you are, and then at day 5, there's 30%. When you get down to days 8, 9, 10, it's a very small percentage, and that's usually associated with still having symptoms. So there's nothing risk-free, but the level of risk is far lower than day 1, 2, 3, 4, 5.
Well, I'm very happy to have attended this seminar, because it'll have practical implications
For
on
you.
how I do my job,
Yeah.
and I get these questions.
Yeah.
I'm in the construction industry. I'm in steel. We have guys down in Boston. They're working out there. They're close. They're wearing their masks. God bless them.
Mm-hmm.
They're taking their temperatures at the gate. If they're sick, they're staying home, but they're dropping like flies. This variant is
so infectious.
amazingly infectious.
Yeah.
And they want to get back to work. How fast can I get back to work? Because they get paid by the hour. They get paid well,
Absolutely.
but they get paid by the
Yeah,
hour.
yeah.
So, this is important to know when we can get these guys back to work.
If I could just make one other point, because we've seen this happen as well. We've had some people that are looking for a test for day 5, and they go for a PCR test. Now, a PCR test is can detect infection and viral particles even in pieces of virus, so it's very sensitive. You could keep testing positive, and we saw this early on. We'd have people come every week to come get tested at our testing site after they were positive. So if you are positive, getting a PCR test, you could continue to get a positive test but not be infectious to others. The test doesn't differentiate that necessarily. If you are positive and you get a negative PCR test, that is a strong indicator that you are not infectious. So it's sort of like, in one direction, it's very clear. The other direction is you could just keep testing positive. And we had people that would come back and were like, no, you're still positive. And then the research is it could be weeks and weeks but you're really not, a threat or a hazard to others.
Okay, I'm glad you mentioned that. That's important. We do have a phone call. We're going to try to juggle all this. We're at our break moment, too. So,
Sure.
Caller, go ahead. You're on the progress report. How can we help you? Oh, looks like we lost the caller. If you'd like to call back, please do. We are right at the 20-minute mark. I think it's a good time to take a very quick break. There's a lot to cover here, and I want to make sure we stay on track. So, Phil, you and I will make a game plan while we're off the air. Folks, thank you for watching. Come back really quick. We'll be back in about 30 seconds. All right, folks, we are back. Thank you so much for staying with us. Again, caller, if we missed you, try to call back. We want to get the callers in here. And Phil, you opened up a very good topic in your answer to the previous question and a half or two, that having to do with masks. And I kind of anticipated we would talk about that. So I brought 3 different kinds of masks here, and I guess what I'm going to kind of move from the middle out. Right now I'm wearing, I guess, what people would call a surgical mask. This is the disposable kind of a paper material. It's several layers. It's got a little pincher for my nose. There's gaps. It's not the best fit in the world.
Right.
But this was the standard, or at least up to a certain point. And after I go through the different things, I have another mask here that my well-intentioned employer gave to all of us. It's got his little logo on here, which is a good thing, and you can wear it. It's probably a little bit cooler to look at than the surgical mask. I know people have black ones and stuff with skulls on them, but this, it's only one layer. It's a piece of cloth. Made me feel good while I was wearing it, but I don't know how effective it is. And then, and I do know we have a caller. We'll be right with you, caller. All right.
We must be covering what they're going to ask.
I hope so. And third, now the thing that we were told, don't go get these, stay away, don't touch these things. They're only for doctors. This is an N95. They also have the KN95, which is a little bit more structurally sturdy. But what this one has is it fits closer to the head. It's much tighter. These elastics go around the head. They're much tighter, and it's it's tested to a much finer granulation. So I've teed it up. These are the options that are available to people. Talk about all of them, if you wouldn't mind.
I'll start by going back in time at the beginning, whenever that may have been, because it seems like I can't tell the end or the beginning, but
Phil, we got this caller trying to call in.
Absolutely.
So let's excuse
I see
me.
the mask. That's a good cue.
Caller, go ahead. You're on the progress report. What can we do for you tonight?
How you doing, guys?
Having a ball.
You guys are great. I like your show. I watch it when I can. But last week I was watching your show and you had Lou D'Alessandro on and a doctor. I think it was a doctor. I caught you a little bit into your show.
Yep.
And I tested positive on the 31st of December. And I quarantined. I didn't get the vaccine. I went to the hospital. I had to get hospitalized. And I just want to tell people that we got vaccinated years ago for the mumps and the measles and different things like that. And I just want everybody to know that please get vaccinated, because if you were as sick as I was, how sick I was, you'd realize that you could die from this very easy. Very easy.
Oh, my.
And,
well, I'm glad to hear you're better.
Well, I am better. This is day 13, I think it is, today.
Mm-hmm.
And I mask up and I wear gloves. I haven't been around any people, really. You know, I got a mother-in-law that's compromised with COPD. And I just want people to get out there and get vaccinated. Please, do the world a favor, because this isn't a joke. It's real. 4 of my next-door neighbors passed from this.
Wow.
And they're wonderful people. And they weren't all elderly. And I just want to say I enjoy your show. And Lou D'Alessandro, he's not a good man. He's a great man. Thank you.
Well, that's a great call.
Your comments.
Thank you for calling.
Thank you very much for calling, and we do appreciate the message. I wanted to let him go because that was from the heart, and that's the kind of message, that neighbor to neighbor kind of thing.
Yeah.
And I can't fault anything he said.
I mean, I think more people need to tell their story, because you can have any of us or elected officials and other folks get up and say things, and nothing is more impactful or resounding than someone's personal experience. So I want to thank the caller for sharing that, because that's not easy. And, if you talk to anybody on the front lines, which, those are the folks that I would want to hear from, like, the doctors and nurses and healthcare providers and workers, in the healthcare setting, about what they're grappling with. I would hope that would resonate. But I think, it's a good segue into talking about things we can do to prevent disease. There's no one size fits all. And I think, unfortunately, we all had the hope that the vaccine would solve everything. And to the caller's point, when we were all younger, we would get our vaccines. We would, I was in the last cohort of people to get smallpox vaccines in 1972. Everybody,
I've got my little smallpox mark.
So everybody did that, and we were able to eradicate things. And I think one of our mistakes, we'll call it in public health, is we thought, all right, we're going to have a vaccine, everyone's going to get it. And, like I said before, we only have 50%-ish people in Manchester, and, not an ideal percent to quell a pandemic.
It's less than not ideal.
Yeah,
it's not enough. It's just not enough. It's not going to do it.
And, our logic was this would follow what we have always done, and it hasn't played out that way. So what other tools do we have if not everyone's going to get vaccinated? And social distancing, all of the screenings we put in place, and face coverings. And unfortunately, this has become, an animal unto itself. And, the way I like to view it is, it is a tool, it is a strategy that works in both directions. And so early on, it was, don't put on an N95 respirator because we need them in healthcare. And the reality was, at that time, that was probably decent advice, because healthcare workers couldn't protect themselves. Now, things have changed, and the virus itself has changed to become that much more infectious, so that a regular cloth or mask that you first put up may have had some level of efficacy early on. This is a whole new animal, and I've never encountered in my circles people who are generally pretty cautious just by nature. Now coming down with COVID just speaks to how infectious this is. Hopefully we'll see that the impacts are not any worse than Delta or its predecessors. But what else can I do? And that's the way I like to think of it is, I can get vaccinated. I'm protecting myself from going to the hospital. I'm protecting loved ones around me. Wearing a face covering in both directions reduces the risk. Is it 100%? No. If something isn't 100%, do we just throw it out? No. It's all bundled together. So the latest discussions have been around, well, what type of mask is better? So if I put one of these, which is a KF-N94, which is just another thing to confuse people, but essentially it's a pretty well form-fitting mask with multiple layers. It has a nose piece. the better seal we have around our face, the less stuff that escapes. Is stuff escaping? Yeah. But if we're all wearing it, there's less stuff escaping and it's less risk. Is this preventing me from breathing? Is it restricting me? I wear one pretty much all day. No, it isn't. Are there some people that may have difficulty? Yes. So in aggregate, the more we do collectively, the better. Is it okay to wear my cloth mask and then another mask? And the research now is if you have two different masks, it's almost like I think I've talked about it before, the Swiss cheese model. Yeah. You've got two different masks and they're better fitting than before. That's better than the first one. If you want to wear an N95 or an N94, you have to be aware that it's not foolproof. And in your working with folks that are working with machinery and particulates, an N95 respirator is a device that I would wear. And if I wanted to protect myself to a very high level, I would get fit tested.
Which we do with all of that. That's part of the protocol.
And that was a problem from a messaging standpoint, is that we would say, oh, you can't wear an N95, you're not fit tested. But the idea is we're protecting everybody else instead of wearing it as a device to protect me.
Yeah.
And so that's a kind of a semantic issue that has really confused the heck out of people. But just know that these are things we can do that help. And the more we do collectively to help, the better. If we decide that we're not going to wear masks and face coverings, we're not going to do any mitigation things, we're not going to increase ventilation, then we're left with more risk. And right now, looking at hospital data is very concerning. It's been concerning since December, if not November after Thanksgiving, where, in talking with our healthcare partners, not only are there, less beds that are available, there is a lot less staff. And even even fully vaccinated staff, and I'll talk about now what CDC is differentiating between fully vaccinated and up to date, which is a booster.
You know what? And I was trying to decide, are we going to go into vaccinating or infection rates for our next topic? Let's go into the vaccinations. We've got about 10 minutes we can talk about that.
Absolutely.
And then we'll talk about the infection rates. But I lost my train of thought. There was something that you had said that
boosters or no boosters, and how CDC has changed some of its language like that. It's become a really difficult thing, because every day we get a list of either employees or students or faculty that are positive for COVID, and the idea is, okay, when can they come back?
Before we get to that, I wanted to talk about, because it talks about both of these things, the things we can do, and then the vaccination.
Yeah.
The quantitative thing.
Yeah.
The fact that I think it's a fact. I think it's, or at least it certainly looks like the Omicron variant is not as deadly as maybe the Delta was, or the original variant. However, being more infectious, more people will get it. And as a result, more of those people will require some level of hospitalization. And as a result, the hospitals will be fuller. So while it itself on an individual basis may not be more deadly, more people may die from it because it's hitting a broader, it's casting a broader net in its efforts. And can you just briefly talk about that, and then we'll swing right into the vaccinations.
So that's a really interesting way of kind of framing it. It doesn't appear to be any more virulent, is the word, or harsher than Delta or its predecessors. However, it is much more infectious. So in epidemiology and the study of disease, we use a term called R. It's essentially, think of it as the rate, or...
It's an R10.
Yeah, it's so infectious, meaning for every one person infected, how many people are around you are going to... And then it's, if you infect 4, then it spirals out of control. Well, this is far more infectious. And then you will have more folks admitted. And some of them, yes, have comorbidities, but that doesn't change the fact that they're admitted to the hospital and they're taking up resources, if you think of it that way. So people can debate about, well, is it because of COVID or is it not because of COVID? If you have COVID, it's impacting, your resources in a hospital setting. What we have seen is it doesn't seem like there are as many people on vents necessarily. One of the public health experts that I follow has spent time in the hospital doing service, and noted that there's less people that are extremely sick as maybe in the past, but there are still that many people in the hospital that are sick enough to be in the hospital, and that is straining the system. So we can debate the fatalities versus not fatalities, but all people in the hospital are taking up beds and resources that if
and
you're
doctors and nurses
and staff and then there may not be as many of those folks available. And so every decision and everything that happens has a domino effect. And if you think about if I need this, what can I do to prevent the strain on the system? I wish we could have that frame of mind, but it is interesting. One thing that the data that we get on a daily basis looks at is unvaccinated versus vaccinated or partially vaccinated. One of the things we struggled with is we don't always have all of the vaccination data quickly because we don't have a vaccine registry in the state, or it's relatively new. And certain partners did not have to report their vaccines into a central system. So
it's basically people carrying a card.
Yeah, we would have to know if you had the card or not. So the data is...
Or actually a card and an email to go with it if you were boosted.
Yeah, right, exactly. And so, but the data has been pretty consistent that around two-thirds-ish, plus or minus a little bit, of folks that are in the hospital with COVID tend to be unvaccinated or under-vaccinated, I guess, which is you have one out of the 2 doses. Yeah. But now what will be very interesting is whether or not people who are boosted are admitted versus people who have had 2 shots, and what is the difference? And the preliminary information from folks that I've been looking at in terms of the data suggests that the booster is having an effect to prevent people from getting to the hospital, and if they are, they're not ending up on a vent. So this is all encouraging that the boosters are helping.
Are doing their job. They're not preventing the infection.
Right.
And I think that's the thing.
That's right.
People say, well, why bother if you don't hit a home run every time you get up to the plate? And it's like, well, you can get 3 RBIs out of a single.
Right. Small ball, right?
Exactly. So I that's why, I understand that I still have some vulnerabilities. I make no bones about it. I got my vaccine as soon as I could. Mm-hmm. I got my second dose as soon as I could, and I got my booster as soon as I could get myself scheduled. But, and quite frankly, Phil, you'll remember the first, I think, 2 or 3 shows we did, I was remote because I was not coming down here.
Right.
And I would not be down here if I didn't have that vaccine.
Absolutely.
To protect myself. Now, I'm also trying to protect other people if I can, but I certainly wouldn't be sitting in this chair if I wasn't completely, whatever they want to call it, fully vaccinated or completely up to date with my vaccines. But the fact of the matter is, and I read an article about this the other day, we can't vaccinate the entire world every 6 months.
Nope.
So that's not the solution to the problem. I'm also reading that the booster that I got has a kind of a short shelf life, and it kind of drops off pretty quick, which, okay, no illusions.
Yep.
I'll take what I can get from it. But, what's next?
So, I mean, that's the $1 million question: is how is this going to go on like a flu shot? The answer is it could, because there are enough people that are susceptible to the virus. It gives the virus an opportunity to multiply and replicate and mutate, and so unlike other diseases which we've eradicated, and that's because we've gotten to 90% plus.
There weren't enough people for the virus to do its thing.
Right, and
it couldn't find the people to be its host.
Yeah, and then
but right now in the city of Manchester, half the people out there or so are just waiting for it.
And then 30-40% across the area, and New England in general has a pretty good vaccination rate as compared to other parts of the country. But
New Hampshire's not as good as the rest of New England.
The data would support that in terms of vaccination. But
New Hampshire's better than the rest of New England in all other factors.
See, I chose my words carefully because I'm just talking about one
I understand
indicator.
exactly, and I stand
love New
corrected.
Hampshire for all the reasons I talked about before.
Yeah, no, and I agree with you.
But I think the other thing to, and others have said this, is where we're at right now. Yes, we have a hospital surge, but we're not talking about shutdowns and other things unless you just don't.
Point.
Unless you just don't have enough staff. I mean, that any business or any entity would have a problem if you just don't have staff because you're all sick. So we're not taking those draconian measures. In an ideal world, when this all first transpired, if we could have collectively said we're going to have to take a pause for 3 weeks and just shut it down, maybe we could have kept the genie in the bottle. But it's completely unrealistic because we can't get folks to, wear a face covering. So, I mean, it is what it is.
I think there was an overestimation of the amount of cooperation that we'd see in this effort. And it's a little disappointing when I think of the great challenges that this country has had to undertake before my life and certainly during my lifetime, going to the moon. People got behind it.
Yeah.
They did what was necessary. Kids were bringing newspapers and old tires in, to help the soldier overseas, even though he might not know who that soldier was.
Yep.
And even though it might not be good for him personally,
Right.
he would do it anyway.
Yep.
But we're at our second 20-minute mark, so I'm going to take a very quick break. It won't be as long as the last one because we only have one more segment to prepare for, and we wing it here. It's live TV. But folks, stay with us. We appreciate the callers. Don't forget to call in 603-640-3091, and we will be back in 30 seconds. And we're back, folks. Thank you very much for staying with us. We have a great guest here today, Phil Alexakos of the Manchester Public Health Department, the greatest department in the city, at least right now. And Phil is a great representative of them. During the break, Phil and I were talking, trying to say where we were going to go with the show here, and we'll talk a little bit about infection rates. But Phil said something that is so true. We're tired of this. This has been a real draining experience. It's been like a war. It's been pervasive. Phil, can you kind of go back to that thought? And
it's I think it's very difficult when the messaging changes. And I recall way back in March of 2020, I think, way back, that I think I on this show talked about how this is all evolving and it's all new, and we have to be prepared for things to change. And just because the messaging changes doesn't mean that we don't know what's going on. It's because we are learning on the fly in some instances, and we're making adjustments accordingly. And you had mentioned like what's happening in Europe right now. There was this huge spike.
Well, I want to talk about that infection rates. I mean, we last 4th of July, I mean, the president gave a speech.
Yeah.
We were almost there. We were ready.
We had the party almost planned. That this was going to be over.
But this variant, this Omicron variant, you can see the charts. I'm sorry we don't have one to put up on the board, but you've all seen them on your local TV shows and your national shows. I mean, it's just going straight up.
Yeah.
But what we've seen in Europe, it's happening there first. Europe and Africa, they seem to be having an equally precipitous drop-off at a certain point. And I know it doesn't predict everything that's going to happen here. They have different circumstances, different vaccination rates, different rules. But what do you see in that regard? Where are we now? I mean, right now it's just pointing up for us.
Right now, I mean, the data is as high in terms of infection rate. I'm looking at one of the state's dashboards about how many infections per 100,000 over a 14-day period. It's 3,305. What does that mean? It's like 35 times what we thought was considered substantial at the beginning of this. So it is, as the viewers probably know, pretty pervasive right now. As is the amount of folks in the hospitals, and we were talking that we saw a rise to levels that were far above the highest points of the pandemic thus far in terms of hospital admissions. Right after Thanksgiving, then there was a dip. Now there's another increase. There's some assets that have been deployed to assist the hospitals because their staff is impacted as well. So, I hope that, some of the messaging that folks are taking advantage of boosters. One of the things that will be very telling in the hospital data is whether or not, as we mentioned before, people that are boosted are really that less likely to go to the hospital. And I think the data is compelling in that is the intended result. So we encourage people to get their boosters because it is making an impact. And ultimately, unfortunately, people are still getting COVID that have been vaccinated. But the way I like to frame it is, yeah, I got COVID. I may or may not have symptoms. It may be kind of bad, but imagine what it would be like if I didn't get a vaccine or I didn't get boosted. And the caller was an excellent example of, here's a person who didn't feel like they needed to get vaccinated, got sick, got hospitalized, and now is like begging people to get the vaccine because they've been through it. I can say that it's a great idea and everything else, but this is someone who lived it. And there's really no better messenger than somebody who's lived an experience.
Well, I mean that what do we have to look forward to? Let's assume, and I don't know about you, and I guess I'll ask the question.
Yeah.
I get a sense that slowly the needle is beginning to move with people. I think there's a core of people that deep in their heart, they're I don't know if it's fear, misunderstanding, or rigidity, and I'm not saying any of those words in a negative way.
Yeah.
But there are people that it's just not. No, I'm not going to do it. I got a thing, and I'm not going to do it. And I disagree with it. I want them to do this for their own good and for all of us. But I got to respect their right to say that.
Sure.
But there are other people that are not doing it for other potential reasons, and I'm wondering if the messaging is not getting to them. What are you seeing there? Are you seeing any increases? Is that population that was holding out coming in for that first shot?
I will say that we've been averaging at our clinics at the health department proper probably like 80 to 90 people every clinic over the last 2 months, roughly. And one of the things we get asked is, are they all boosters? And most of them are boosters, but we have, and it seems like with people finally either knowing someone who got COVID or maybe sharing that experience or seeing on the news about there's not a hospital bed or whatever the case may be, that there are people who are coming for their first dose, and we are a resource for people to do that. And the best messenger is people who have lived it, and that is very important. I don't know everybody's medical history, nor should I, but if you have underlying health conditions, we do know that COVID is far more impactful, and you're far more likely to end up hospitalized if you have those risk factors. So if you need to talk to one of our staff, you can call the health department and we will talk to you and answer your questions. And sometimes that's all that people need. And we've had instances where we've gone out to places and people are getting vaccines, and we'll talk to people and they're like, nah, I don't need that. But the more that you're out there, the more that you just have contact with folks and give the opportunity to answer questions. And the more that people who have been impacted share their stories, it's not to scare people, it's to say what is really happening. It's not something on social media, it's not anything glorified, it's a person's experience. And I truly appreciate the person calling, because they kind of said it better than I ever would.
Well, it was a great call, certainly timely, and I'm happy it added to the show. There's no doubt about that. You bring up a very interesting point, and it kind of triggered something in me. A lot of people, because of this, I'm not going to editorialize, a lot of people just don't have a primary care physician. Mm-hmm. Or if they do, they don't even know who he is or she is.
Yep.
So, they can call the health department.
Absolutely.
Someone like that could take it. If they live in the city, they can call the health department, talk one-on-one, get the advice.
Yep, even if you didn't live in the city. As one of two local health departments, us in Nashua, we are a resource that you just don't have. I cannot tell you the number of times people have been on hold trying to call the 211 or the state, which are, 211's a great asset, but they're overwhelmed. Systems are overwhelmed, but our health department is working every day of the week on this for the last 2 years, and we have nurses or other staff that will be happy to answer your questions. And that's why we decided we're just going to have these set times where you can come and get the vaccine when you're ready, and then we have our other outreach that we do in the community for different groups. We are a resource that we want folks to take advantage of, and if you need to come and sit and talk to us, we'll socially distance, we'll wear a face covering, and we'll answer every question you have, and and we'll share information. And if you need resources, we can help connect you to other resources if that's something that's also a barrier, or something. When you're struggling in other ways, the last thing you're thinking about is getting a vaccine.
Yep.
And so if we can help in different ways, we have some great new staff members that we've taken on board. We have community health workers, which are, think of sort of like the public health boots on the ground for resources for folks. So some of that is money that we've got from grants. Some of it is ARPA money. And we're looking to have representatives strategically embedded in organizations across the community. And I'd love to come back and talk about that at some point.
Well, we'll definitely, you have our promise. You can come back. We want to keep you as a regular guest.
I'm happy to. You can talk to my agent, I guess, right?
Well,
who's
we'll have
me,
to ink a contract.
Or my wife.
Thank you for answering that question. Yeah. And I have another one that's come up, and these things come up a lot.
Oh, yeah.
Really, it's not been hard to come up with questions for you. They've been swimming around. You have the vaccine. Your body does produce a certain amount of antibodies. Mm-hmm. Are you good to go, or should you then, if your mind has been changed, get the vaccine too? Because I've heard that vaccinated and having natural antibodies from having had COVID is almost like a superpower. Can you correct me if I'm wrong, or talk about that? What's the best advice in that?
So if you're within 90 days of a confirmed COVID infection, you are thought to have enough protection that if you're re-exposed, then you are not required to quarantine. So think of it as you have an analogous level of protection, but it's a really relatively short window. Uh-huh. And natural infection triggers certain your immune system to respond in different ways. Vaccination protection triggers your immune system to respond in different ways, and I'm not going to get into the B cells, T cells, and all of that, but essentially, there are markers of how well your body is going to respond if it's challenged again. If you are, one of the questions we get often is, I just had COVID, when can I get my booster, or when can I get my shot? We have been kind of after 10 days, your body has had a chance to sort of reset itself from the actual infection. The new guidance from CDC suggests you could do it, after on your 6th day if you're negative. But, in our discussions, you want your body to be ready to elicit a response that will give you the best protection. So waiting that 10 days is a good idea.
Got it.
And if you are really sick, you're going to want to wait a little bit longer. There's other information about, like, we didn't talk about the flu. We had very little flu last year.
We're running out of time. I'm very sorry. We'll have to get you back. But
I'll just say, the flu is circulating right now, so you can get the flu shot and the COVID shot. You can even get them at the same time. Yeah. But that may be more for convenience. Again, our mindset collectively is you probably want to wait a good 14 days is usually a buffer as a guide. You can get them at the same time, but we like to think that your immune system should be primed to elicit that strong response and to wait a little bit, unless there's a barrier to getting you back. If that's the only time we're going to see you because we're out doing field work, then maybe we will do them at the same time. It's safe to do it, but we want to give your body the best chance to
sort of like
build.
A catcher. He's got a better chance if he's only catching one pitcher rather than two at the same time. So. Understood, Phil. There's so much more we could talk about, but we've kind of come to the end of the show. Thanks to our viewers for watching. Thanks to our caller. Other people who are too shy to call, you should call in. We have great resources on the Progress Report, and you can get one-on-one with them. But we thank you for coming on, Phil. We definitely want to have you back later on in the year. You provide great information, and we like to provide that public service here on the Progress Report and get that out.
Great.
Folks, thanks for watching. We're going to end the show, but I'm going to go out with a short video. This video is something that you may have seen last week, but it speaks to how we at the Progress Report feel about the United States of America, our country, and our community, and it speaks well for us, and so we want to just present that to you. Folks, thanks for watching. We'll see you next week.
1 year ago today, in this sacred place, democracy was attacked, simply attacked. The will of the people was under assault. The Constitution, our Constitution, faced the gravest of threats. For the first time in our history, a president had not just lost an election, he tried to prevent the peaceful transfer of power as a violent mob breached the Capitol. But they failed. They failed. Are we going to be a nation that accepts political violence as a norm? Are we going to be a nation where we allow partisan election officials to overturn the legally expressed will of the people? Are we going to be a nation that lives not by the light of the truth, but in the shadow of lies? I will stand in this breach. I will defend this nation. And I will allow no one to place a dagger at the throat of democracy. We will make sure the will of the people is heard, that the ballot prevails, not violence, that authority in this nation will always be peacefully transferred. This is not a land of kings or dictators or autocrats. We're a nation of laws, of order, not chaos, of peace, not violence. Here in America, the people rule through the ballot, and their will prevails. So let us remember, together, we're one nation, under God, indivisible. That today, tomorrow, and forever at our best, we are the United States of America.